through a lot in the last 16 years. I've been to numerous doctors, numerous therapies, medications and injections, and until I met Trista and started this therapy, I was in pain, constant pain. And I can't say that anymore. I wake up in the morning and I don't even think about pain. I get ready, I go, I take care of my grandsons, I do all kinds of things now that before would have been a little more difficult.
Okay, so craniosacral therapy is considered to be a light touch massage that targets primarily the craniosacral system within the body. And that is the cerebrospinal fluid that flows between the brain and the sacrum. So I'm targeting points all along those portions of the body. And I'm working to increase the flow of the fluid. And what that does is, in many cases, especially folks with chronic pain, that helps to induce the relaxation response in the body. And their body doesn't know what it feels like to be relaxed in that rest and digest phase that we can go back and forth between. And so craniosacral therapy is really, in many cases, like a bridge to remind the body how to relax. And then I also work with my patients to implement ways within their lives other than just the treatment to induce that relaxation response. So we do a lot with breathing techniques and just body awareness to help them be more in control of their pain.
Pain would have always been in the background, and it would have made me tired and irritable at some point. And now there just isn't any of that. At the worst, I probably a 2, and I stop thinking about it and it seems to go away. So it's really been a godsend.
So if someone were to come in for an evaluation, we would meet for about an hour, and within that time frame we would spend quite a bit of time just taking up some history, and we'd have the opportunity to start a treatment. And then what a patient can generally expect is I see patients usually 1 to 2 times a week between 30 and 45 minutes. And a session takes place in a lying down position on a mat table, as comfortable as possible. So again, if chronic pain is an issue, we can bring in props for comfort. And it's really a very relaxing experience. So if you're experiencing chronic pain, just for example, that we were just speaking of, from fibromyalgia, from migraine headaches, or just chronic tension headaches, sometimes intense back pain, shoulder pain, neck pain, in many cases, just someone with high anxiety, you can talk to your physician and get a referral very specifically for craniosacral therapy. And because I'm an occupational therapist, it would need to denote occupational therapy.